Good morning, it's Dr. Larson here to talk about COVID-19 in Kittitas County. I hope you all had a very small, quiet, safe Christmas. And we'll talk about numbers, we'll talk about COVID-19 vaccine, and we'll talk about the upcoming holidays. So our numbers are still really high. Our incident rate is 586 per 100,000 per 14 days, and that's up from 581. So not up a whole lot, but we've been above 500 and have continued to be above 500 for the last few weeks. That's been a bump from Thanksgiving. Again, we expect to have another bump after the Christmas and New Year's holiday, which is putting some stress on our hospital system and also putting some stress here on the health department in regards to our case and contact investigation. Again, if you remember, our goal with that number, that incident rate number, is to be we had to be less than 25 cases per 100,000 per 14 days to move into phase 3, where we are continuing to be currently, but the phases will be changing, and I'll talk about that in a minute. Our percent positive rate, that's the number of tests that are coming back as positive. It's kind of a reflection of whether or not we're doing enough testing. The goal is to be less than 2% positive, which means out of 100 tests, you should be having 2 per 100 should be positive. Currently, we're at 12.3%, and that's up from 10.6% last week. So we're not really testing enough people, and we have a lot of people that are positive. And what that is telling us is that there's a lot of people in the community that are positive for COVID. We still continue to have cases in our long-term care facilities. We have cases that are currently in lots and lots of businesses in the community. Any situation where people are getting out and about and spending time without their mask on. In regards to case and contact investigation, we are having a really difficult time keeping up with the cases that we're seeing. The target rate for people reached within 24 hours is 90%. We are well below that, and just so we know that the new cases in that 2 week period of time, the last 2 weeks, 273 cases, and our case and contact investigators are trying to reach those people. We are having some issues with people not answering their phones. We're having a little bit of issue with people not sharing information, but for the most part, people want to get better. They want to protect their neighbors, and we'll get on to the COVID-19 vaccine. We're starting to look at regional data for hospitalization. So we've talked about how many patients are in the hospital at Kittitas County Hospital, Kittitas Valley Healthcare. As of yesterday, we had 6 out of 11 patients that were in the hospital had COVID-19. If you remember, most of the time when I've talked about those numbers, we've said we've had 1, we've had 2. We have a lot of people in the hospital with COVID-19. In the region, which the South Central region is Kittitas County, Yakima, Benton Franklin, and Walla Walla County, 27% of the beds of those in those hospitals are taken up with people that have COVID, and the goal for that is less than 10%. The reason that that's an important number is that it's not that they don't have beds available to put people. Most of the time, they don't have staff available to take care of those people, and that's been the case because we're seeing COVID-19 in healthcare workers. That people are exposed to their family members that have had COVID-19, so we're having difficulty with staffing. That's true across the United States. Staffing is a big issue. If you really want to know where it's a big problem, look at the data in regards to Los Angeles. Their intensive care units are full. Their staffing is really a problem. So we're having difficulty with that. On a positive light, we have received the COVID-19 vaccine. So we have 2 current COVID-19 vaccines in Kittitas County. They are both messenger RNA vaccines. Pfizer vaccine is one, and Moderna vaccine is the other. We are currently giving those vaccines to, we're trying to look at who's at highest risk and who are in areas where people have been put at risk because of the kind of work that they do, for example. And so the current phase that we are in is phase 1A. Phase 1 is our healthcare workers, first responders, those paramedics, ambulance crews, those type of things. And we're working through those folks. Also in 1A are folks in the nursing homes. So Prestige Nursing Home is actually going to be getting their vaccine starting on the 31st. It's a 2 vaccine series. Moderna is 28 days apart. The Pfizer vaccine is 21 days apart. So we're currently giving through KVH the Pfizer vaccine, and again, on Thursday of this week, the nursing home is going to be getting vaccinated. We are also vaccinating our Upper County adult family homes. They were all vaccinated this last week. We are working with the long-term care facilities here in town. They are contracted with CVS or Walgreens, but it may be a while before those folks are able to get those vaccines. So we are planning on working out a situation where we can start vaccinating people at high risk in the nursing homes and long-term care facilities. So what does that leave in 1B? 1B, not all of the folks in 1B have been figured out, but we do know that people that are older than 75 are going to fall into tier 1B. So, and we'll probably start giving the Moderna vaccine to those folks within the next week or so, probably starting next week, I would guess. Community Health of Central Washington has Moderna vaccine, Safeway has Moderna vaccine, and we, through KVH and Public Health, have Moderna vaccine. So we will start getting vaccine out. There's a process that the state's putting out called Vaccine Finder that we will be able to push out through the PIO here at Public Health once that's available, and you'll be able to go on and say, where am I, what phase am I in, when can I get vaccinated? So it's really important to be vaccinated. The vaccine is safe, it is effective, it's over 95% effective. There are side effects there are side effects with all vaccine. They're mild, they mostly are muscle soreness, some rash, those type of things, and with a little bit more vaccine related side effects with the second dose because you're getting that immune system response. The vaccine is, even though developed quickly, is safe, and it's safe to take. I noticed at the Catholic Church this Sunday that the priest had brought up the fact that there are no fetal cells that made up the vaccine. People don't have to worry about that. There's a lot of false information on the internet, so please reach out to Public Health, either here in Kittitas County or with your own provider, or reach out to the Department of Health for accurate information. But the vaccine is safe. As you've probably seen, we look forward to having more and more people vaccinated. And the higher number of people that we get vaccinated, the more quickly we're going to get back to normal. So back to normal, what's that going to mean? That's going to mean being able to have dinner in restaurants, being able to have sports again, and those type of things. So please consider being vaccinated when your phase comes up. We will get those phases out as soon as they're available from the state. So and when somebody calls you and says, hey, your number's up, please come in and get vaccinated, please make an appointment to do that. So we are starting to look a little bit at changing phases looking at a regional approach, again, looking at that hospitalization data. So why are we looking at a regional approach to the phases? It's because most of our hospitalized patients that we can't take care of here go to other places. They go to Yakima, they go to King County, they go to Wenatchee. So we have to look at what's happening in the areas around us. So when you start hearing about regional approaches, that's what that's about. So the last thing I want to say is please be safe over New Year's. Please celebrate outside, celebrate in small groups. We know it's an important holiday. 2021 will be better than 2020. So there's a good reason to celebrate, but make sure that you're outside. If you're inside, you're with small groups of your immediate family, and remember to wear a mask and be kind. Thanks a lot.